Hi, my name is Angeline Koo. I'll be performing the skill IV insertion and discontinuing IV. I'm in my pewter uniform and I have my badge. To begin with, we're going to go ahead and knock on the patient's room. Knock, knock, may I come in? Go inside. I close the door, provide privacy. Hi, my name is Angeline Koo. I'll be your nurse today. The provider has ordered for us to insert the IV access into your arm. Is that okay? Sounds good. Before we begin, can I please get your name and date of birth? They're going to give me their name and date of birth. I'm going to check a second form of identifier by checking their wristband. So we're going to be inserting the IV into your arm. Is there any drug allergies that I need to know about before we begin, or any kind of allergies at all? No? Sounds good. We're going to go ahead and begin. We're going to go wash our hands, don gloves. We're going to go ahead and prep the tubing. So when we're prepping the tubing, we're going to go ahead and flush the tube with the NS solution. Dispose. Take that, dispose. And we're going to flush by flushing the tubing and making sure that water returns on the other end. We can be sure that there is no air. Good. So now that we made sure that the tubing is good, we're going to grab all our supplies. So we have our IV start kit. I already have placed tape here as a prep. And we're going to use a 18 gauge needle. I'm going to grab a tourniquet. We're going to go ahead and tourniquet the arm, the upper arm, about 4 to 6 inches above on the upper arm. We're going to put the tourniquet on, easy release, not too tight, about 4 to 6 inches, again on the upper arm. We're going to go ahead and check the pulse. Pulse is good. We can begin. We're going to clean the site. We're going to grab an alcohol wipe. And then we're going to clean the site, making sure that it dries. We're going to go in a circular motion. Wait for that to dry. So while that's waiting to dry, we're going to open our catheter. When we're getting our catheter, we're going to make sure that we actually have the bevel going up. Bevel's up. Dispose of that. We're going to go anchor down about, we're going to press our thumb on the vein, anchor it down. We're going to be inserting about 2 inches below distal to where the intended site is. We're going to be puncturing at a 30 to 45 degree angle. So we're going to insert 30 to 45 degree angle. We see some blood return. Now that we see blood return, we're actually going to flatten out, and we're going to go in about 1/4 more. And then after that, we're going to push with our index finger the green hub. Now that it's there, we are actually going to click, release, dispose in the sharps container, and then we're going to stabilize the VAD. We're going to release the tourniquet. We're going to grab the lure lock and make sure that it's in place. Now that it's in place, we're going to not push the NS yet. We're going to aspirate, make sure that there's blood return, and then we're going to inject at a good rate, making sure that the patient is tolerating. For the purposes of this video, I'm not gonna do all the way, but I would insert all of the NS all the way. And then now that we've inserted all of the NS solution inside and the patient tolerated that well, we're actually going to clamp the tube. Now that the tube is clamped, we are able to take the empty NS solution, dispose of that. We're going to grab the Tegaderm, and then we're going to stabilize the thing in place. So now that we have this stabilized in place, I'm gonna go ahead and grab that and then tape it. Good. Tape it on the patients. Tape it in place. All right, we're going to get the white part off of the Tegaderm now that it's secure. I'm going to label with our initials, the date today, the time, and then the gauge. So 18. I'm going to place it on here. Okay, now that we have that, we're going to go ahead and dispose of all of our stuff. Dispose, dispose. Let me get another tape. Just tape that securely. Boop, boop, boop. Okay, now that we have secured the tubing and disposed of all of our equipment, I'm going to go ahead and make sure that the patient is comfortable. I'm already done with the procedure. Is there anything else I can do for you? Good, you're in a comfortable position. Here's the call light. Don't hesitate to call us if you need anything. Dispose the gloves, perform hand hygiene, and then I would go leave and document. As for discontinuing, we're going to do the same thing that we did in the beginning. We're going to go ahead and knock on the patient's door, enter, close the door for privacy, introduce yourself. Hi, my name is Angeline Koo. I'll be your nurse today. I'm going to go ahead and let them know that I'm here to discontinue the IV that was inserted, perform hand hygiene, don gloves. Is there any kind of allergies I need to know about, which we don't really need because we're just discontinuing the IV. We're going to make sure that we have the correct patient. So I'm going to get their name and date of birth, and then I'm going to go ahead and check their wristband as a second form of identifier. We already explained the procedure. We're going to go ahead and discontinue the IV. So when we're discontinuing, we're going to go ahead and have our gauze ready. And I'm going to actually have tape ready so that it's easily accessed. Good. So we're going to be securing the site, and then we're going to remove carefully, making sure it's being removed parallel to the skin. So, are you comfortable, ma'am? That's good. This will only take a few moments. Just gonna make sure that I'm trying to do this as comfortable as I can for you and as careful so that you're not in any pain. So parallel to the skin, we're almost there. We stabilize this, grab that out. Dispose, we're gonna actually get a gauze, apply pressure on the area, and then we're going to remove slowly. So slowly, making sure that they're comfortable. Dispose. We're gonna hold it there for 30 seconds to stop the bleeding. Before we actually dispose of this in the sharps container, we're going to inspect it to see that it's intact and to see like the tubing and everything and the integrity of the catheter and the tip. And we're going to dispose. It's been 30 seconds. There's no more bleeding. We're gonna go ahead and get a new gauze, dispose of this in probably like a red container because it has blood. And then we're going to apply new gauze over the site. Tape it down so that it's intact. Make sure that the patient's comfortable. Is there anything else I can do for you? There's nothing else I can do for them. They said that they're comfortable. I gave them the call line so that they can call us whenever they need something. And then I'm gonna go ahead and discard my gloves, perform hand hygiene, let them know that I'm gonna be leaving and call us, and I'm gonna go ahead and document.